Presentation, we're going to be having some injury assessments from 1 to 4. Basically, it's the first 15 to 20 minutes of our appointment. We put you guys through some functional orthopedic movement testing just to find out what exactly is going on with the pain that you have. If something pops out that it might be a slight tear or a full tear or a broken bone, those are the things that we don't work on in the office, so that's something that we would have to refer out. If for some reason it is something we can take care of, we'll talk to you about scheduling, okay? Once we determine if this is something that we can work on, we use our thumbs to go through the tissue, okay? We work on a specific tissue that's called fascia. Has anybody heard of fascia before? Good. For those of you that haven't heard of fascia, it's a very thin layer of tissue, covers the entire body, helps a lot with movement, things like that. For those of us that have ever cleaned fajita for a cookout, that very thin layer of stuff that you take out because it's real gross, that's exactly what fascia is. Every living thing has fascia in it, okay? We use, like I said, we use our thumbs to align that tissue, getting everything moving in the right direction. That's only part of our treatment. The second part of our treatment is the rehab side of it. We're going to give you guys some specific exercises and stretches for your injury to help develop that muscle or kind of loosen up the tissue, whatever we need to do to help you get better a lot quicker. But once all of that is done, the biggest part of Airrosti that you're going to take away is that we're going to educate you on what's going on. So a lot of people come in and say, like, I have back pain. They think, oh, it's because I lifted something heavy, but actually it's due to a hip advancement or it's due to something other injury that just led up to some back pain. So we kind of discuss all of that so you know how to prevent this from happening in the future, okay? So I kind of bring this to our class today. Headaches is just not in your head. Today we're going to go over, move this real quick, understanding different types of headaches. We're going to talk about impact of postural stress. We're going to go over tools of prevention and tracking of different headaches and migraines. And then we're going to go over a little bit more of the accountability outcome base for Airrosti, just why City Mechanic has pretty much partnered with us, okay? So next thing we're going to talk about is the different types of headaches. So I'm going to pass this off to Dr. Ramon. He's going to go over it for us. He's just going to go through the different types of headaches, some of the symptoms, why these things occur. If you have any questions, shoot up that arm. We'll go ahead and answer anything you guys have, okay?
All right, thank you, Mom. Okay. All right, guys, types of headaches right over here. A quick overview, we got TMJ, we got sinus cluster, tension, migraine, and neck. I think a lot of people would say that, hey, I've got a migraine headache when they've got really actually one of these other kinds, one of these other types of headaches right over here. I love these pictures. Gives us a great a visual of where your presentation of that headache usually is, okay? So we're going to go and go through these one at a time right over here, okay? We'll start out with sinus and cluster. I think we all know what sinus headaches are. Our sinuses are located right over here, right in the center, above the eyes, in between the eyes, and also in our cheeks. Usually, you know you got a sinus headache, you've got the symptoms like allergies, you've got a cold, sinus infection, changes in your position. When you go from laying, maybe to sitting up, or from standing to laying down, you're going to notice a change in pressure and almost a change in pain as far as that location is concerned. We always recommend you go see your primary care provider when it comes to these types of headaches right over here. What we do is not really going to help with this, okay? Cluster headaches kind of come in bunches right over here. One of the biggest things is they can last anywhere from 15 minutes to 2 hours, okay? And you see our picture right over here with that nice little diagram just located at the eye area, okay? So these, again, this is just going to be a visit to your primary care provider. TMJ, you know, a lot of TMJ issues really come from stress, a lot of grinding of your teeth at night. Sometimes you guys don't really know you're doing that. Or maybe you do when you wake up in the morning and you realize, like, holy cow, my jaw is just so sore, it's just so tight right over there, okay? A lot of that can be from just stress, okay? Stress-related types of things. And of course, dental issues as well, alignment of your teeth, alignment of your jaw. I think we prefer to co-manage these cases. We do treat this local. There's a local component of soft tissue things going on in there, fascia. There's a little disc inside that TMJ joint right over here inside the jaw that we can work on. Other muscles associated with chewing and talking as well. We work those, but I think we do prefer to co-manage these with your dentist and make sure that we get the jaw aligned, we get the teeth aligned, and that helps. Tension headaches, we're going to go into a lot of detail here, just a little bit about the tension headache, because this is the one that we can really treat, but one of the most common sites of this tension headache pain is just going to be like right above, right over here, and usually that's a referred kind of a pain coming from more of the neck. So this is one of the ones that is a big, true soft tissue component, and also posture. We're going to show you guys a little diagram of what proper posture at a computer desk is all about. Some interesting facts about your head position relative to the rest of your body. When we start pushing our head too far forward, that's not so good, okay? So we'll talk about that in a lot more detail here in just a little bit. Migraines, we have several types of migraines, guys. We're not going to go into that too much right over there, but you can see the presentation as far as like the location is concerned right over here with our picture. But usually we have some associated, not just a headache, but some associated nausea, vomiting. Most of the time there's visual disturbances or hearing disturbances as well. Bright lights are cause a lot of flare-ups in these cases. Sometimes you see wavy lines as well, polka dots, those kind of visual disturbances as well. So if you're having those kinds of symptoms right over there, that is more of your migraine category, right? Okay. And migraine triggers, there's a whole bunch of them right over here, just a whole list, several on there right over there. I'm not going to really touch into that too much. Cervicogenic headaches, this is, cervicogenic just literally means coming from the neck, okay? You can call this a tension headache, a cervicogenic headache right over here. Very, very common type of headache, and a lot of times these patients, they are so bad that they'll think they have a migraine. For a lot of patients, it's like, my headaches are so bad, the severity of it, and I think it's a migraine. They lack a lot of those other symptoms. It's just a bad cervicogenic headache, okay? And this is really where we can help these, we can really get a lot of relief for our patients and actually correct this problem right over here, okay? Let's see, right over here. Doc, do you want to talk a little bit about posture? Right over here. So Dr. Guthrie is going to talk to us a little bit about posture. This is really, really neat little picture right over here and some of the treatment things that we do for cervicogenic headaches.
All right. So yeah, so when somebody comes in with a cervicogenic headache, they're going to present with a lot of stiffness, like they can't move around. You're not going to be able to turn to one side, so loss of range of motion. The pain could be very deep, like in the joint. It's coming from the muscles being really tight. And there may be some points, like you may feel like, hey, I need something to dig into my shoulder, like my neck right up there where it connects. A lot of the contributing factors to this is going to be posture. So what you're doing throughout the day. So as you see, like this first picture where it says correct posture, like the neck is right on top of the spine, everything's in a neutral position, so your muscles can work efficiently. But we do a lot of things throughout the day that are going to bring us into this forward position. So we're driving, we're texting, we're sitting in front of the computer for 8+ hours a day sometimes. And this could cause us to lean forward. And once we start to lean forward, our head is going to kind of lean forward and pull forward, and our head is pretty heavy. So it's actually putting a lot of stress on a lot of the muscles in the neck. So once you start to do that, the muscles in the front are going to be really tight, the muscles in the back are going to be straining, and that's where a lot of the tension, the tightness, and all those little trigger points that you feel like your neck and shoulders are going to come from, because your muscles are working extra hard to keep your head up in that neutral position. And then, of course, if it's there over time, it can get worse and worse, and the more you lean forward, the more your head's in a forward position, the more stress you're going to be putting on those muscles in your neck. So this type of headache, because we are putting a lot of stress on the muscles of the neck and shoulders, are going to respond well to what we do in our office, which is a lot of manual therapy. Then we use our hands to kind of work through all this soft tissue, get everything to loosen up, lots of stretching. If you can maintain the muscles nice and stretched out throughout the day, you're going to have less of those trigger points, less of the stress on the neck. Icing, and then rehab, so active care. So not only do we have to stretch out the muscles and make them all loose, we need to strengthen the area, because you've probably been doing that same activity for a long, long time, and those muscles have become weak over time as well. So we need to stretch out the muscles that are tight, and we have to strengthen the ones that are weak in order for you not to come back for the same thing over and over again. So when we treat you in our office and we show you what you need to do to take your pain away, we want to make sure that you're able to maintain it. So strengthening that area is going to be really, really crucial, so that you don't come back to us over and over for the same thing. And of course, NSAIDs, so anti-inflammatories, because all that stress on those muscles are going to cause some inflammation through the muscles in that area. So being proactive is one of the things that you need to do to eliminate some of this pain. So it's hard when you already have the pain to take away the pain, but if you can do these things right here, you can eliminate the pain from coming so that you can stay on top of it. So one thing is your posture. So sitting up straight when you're in front of the computer, and everybody kind of like straightens up a little bit, but yeah, so you straight, not just when you're sitting like eating, but when you're in front of the computer, you know, you're there for a really long time, so it's really easy to get into this position because you're there for a long time. Putting that computer screen in front of you instead of like off to the side. If you're looking off to either side for a lot of your day, that may give you some pain on one side more than the other. But if you put it right in front of you, your neck doesn't have to be compensating from one side to the other. So it's going to be a lot better, a lot less risk of you getting some tightness on one side of your neck. And then stretching. Getting up, taking frequent breaks so that you're not getting stiff in that same area. And then actually sitting in your desk and doing some neck stretches so that you don't feel so stiff after an hour or two of sitting there. And then know your triggers. Some of these headaches that people are getting, not just the cervicogenic headaches, are going to have different triggers, like the migraines and everything that that Dr. Ramon was talking about. Sometimes it's light or certain smells or certain foods or something that you can avoid. So if you can avoid your triggers, it's going to eliminate you from getting some of these headaches. So kind of like this lady here on the left, she's kind of leaning forward into her laptop. She's her shoulders are slumped forward, which means her head is way forward. So the muscles on her neck and her back, they're working extra hard. After a while, if she's sitting there for like hours and hours, it's going to put a lot of stress on her neck. She's going to have neck pain and could trigger a headache, because if your neck is nice and tight there, it's going to, it comes into the back of your head, and the muscles that are in the back of your head innervate your head, your face, and things like that. So they could give you some of the symptoms that we were talking about earlier. But if she sits nice and straight there, she's not going to have as much compensation. She's going to be able to sit there a longer amount of time. She's not going to be in pain. All right, so here are some of these stretches. I think we're going to demonstrate some of the stretches. Okay.
So just like how Dr. Gantu was talking about, being aware of your posture, which was the first slide, just making sure throughout the day, be aware of it. If you kind of work together as a team, if you work together in an office, kind of just point out, hey, your posture's bad, or oh, look what you're doing, just kind of keep everybody aware of it. The second part of making sure that this tension headaches and cervical neck headaches don't occur so much is by also stretching. So one of the things that we're going to do is we're going to do one that I call a 3-point neck stretch. So you're going to stretch out 3 different points of your neck. So the first thing we're going to do, and if anybody wants to try this with this, go ahead. This is not really going to cause any pain or anything. If it does for some reason, just go ahead and stop it, okay? So what Dr. Kazu is going to do is grab the bottom of the chair with her right hand. We're basically going to use this as an anchor, because when we stretch over to the side, we don't want this shoulder to shrug up for us, okay? So all she's going to do is tilt her head to the left, and we're going to get a nice long stretch down this muscle right here. Usually you want to hold it for about 20, 30 seconds. Like I said, get a nice little relief stretch. Once you're done with that, you can go ahead and keep in that same position, look down into your pocket, okay? This is going to help stretch out towards the back of the neck, okay? Yes, it looks like she's falling asleep, but she's not falling asleep. She's just doing a stretch, guys. So if we have any managers here, if you see your employees doing this, they are stretching, okay? Good. Well, again, 20 to 30 seconds. Remember, getting a nice stretch down that long muscle on the back. And then what you want to do is just stay in that same position, looking up towards the ceiling. You're going to get a lot of that frontal chest stretch kind of going to the neck area too. This is somewhere where a lot of us feel a lot more of the tension when we do this one. Again, because we're in that frontal position most of the day, driving, texting, working, things like that. Okay? Go ahead and relax it. And then you would just follow it on the other side, okay? Again, if for some reason, if you get into that stretch and you feel pain, stop it, okay? You don't have to go and feel, oh, I feel the pain, that's a good thing. No, we want to feel a stretch, okay? Because sometimes we have people come in the office and they're like, oh, I felt pain when I was doing that, and it never went away. Yeah, it's not going to go away. So we want to make sure that you just feel that stretch. All right. Again, so we want to go do some more stretching. We have the seated neck retractions. So this is again when we were talking about being in that frontal position, kind of you don't even know you're doing it when you're looking at the computer or your text, and then all of a sudden you feel all that tension when you come right back, right? What you want to do is staying in this upright position, basically like a chin tuck. It's gonna rotate your neck back and forth, okay? Some people call it a little duck walk too, when you do that motion. That's what we're talking about, okay? Again, this is gonna help loosen up a lot of the back muscles, stretch it up, even strengthen it up a bit too, okay? If you want to kind of make this a little bit more challenging for you, or make it more of a strengthening, when you go home at night and you go to bed, put your head on the pillow, same thing, keeping everything nice and tight, putting it against the pillow, and then release it, okay? A good tip for everybody, I always tell them, is like pick a point on the wall, and just keep looking at that, because sometimes we have people in the office and they start doing that, and then they start doing this, and they keep going up, and it's like, nope, you're not doing it anymore. Go back to, reset, and try it again, okay? Good. Next one we're going to talk about is scapular retraction. So again, we're going to go back to that same demonstration when you're at a computer or at a desk and you kind of slunch over this way. A lot of these muscles in the back are going to get real weak because they're being overstretched, right? So a lot of people, sometimes we tell them like, okay, just get into that right posture position. They come up and they're like, it just doesn't feel right. It doesn't feel good because we've already gotten accustomed to being like this. So one thing you want to do is just retract those shoulder blades, shoulders up, squeeze nice and tight, and then release it, okay? Good. So you want to get like this little crease right here in the middle. There, okay? We had somebody once tell us that just imagine you have a little bug crawling up right here and you want to squish it with your shoulder blades, okay? Exactly what you want to do. Sometimes what people do in the office too is they shrug up when they do this. We don't want to do that. We don't want to shrug and squeeze. Shoulders are nice and back, nice and flat. Tightening it up and loosening, okay? Good. Any questions on those guys? Pretty simple, right? Good, okay. So these are just a couple of the stretches and exercises that you can do at your desk. It doesn't require any kind of equipment. All it does is taking the time to think about it and say, okay, let me do some of these stretches every hour, every 2 hours, whenever you feel that you need it, okay? One of the other things that we talked about in the presentation was knowing your triggers and tracking them, okay? A lot of patients come into the office and they kind of like, I have a headache, I have a migraine. Okay, what do you think causes it? I have no idea. It just happens around 2, it happens around 3 o'clock during the day, but I don't know what I was doing, I don't know what I did the day before or the day of, okay? This little tracker on the back of the sheet that we gave you guys is going to help make this a lot easier, okay? It's going to make it easier for us, it's going to make it easier for your primary physician if you go see them. All it looks like is what's on here. You track your headaches by putting the date and the time. And we got a little image right there where you can kind of just pick your location. Is it in the front? Is it in the back? Is it on one side? Real easy to circle. Go ahead and put your activity, things that you were doing the leading up. I was, on my cell phone, I was driving, I was asleep and it woke me up, things like that. Then the severity. Is it a 1, 2, 3? Is it a 10? And we're going to track that all the way down. How long did it last? 2, 3 hours, 30 minutes? What was the last meal? And then what helped to take it away? Did it just go away on its own? Did I take medication? What did you do to help get rid of it? Again, there's a lot of different reasons why we can have different triggers. It could be, too much coffee, too much caffeine, not enough caffeine, things like that. We didn't get enough sleep. We know we ate a certain meal. We're allergic to something that's causing inflammation. So there's different things, and not everybody's the same. So this is going to help us really track it down. Okay. I gave everybody a little take-home sheet. It has your exercises on here so that we can kind of put it up in the office and know, but it also has your